Let's talk about obesity properly. Not the headline version, not the shaming version. The real health picture that most people never get explained. In the UK, obesity isn't just common, it's widespread. Over 60% of adults are classified as overweight or obese. That means this conversation applies to more people than it doesn't. But what's rarely explained is what obesity actually affects inside the body. Type 2 diabetes is the most well-known link. In the UK, around 90% of people with diabetes have type 2. And excess body fat, particularly around the abdomen, is one of the strongest risk factors. What many people don't realize is that type 2 diabetes doesn't start with sugar. It starts with insulin resistance. Your body still produces insulin, but it stops responding to it efficiently. That leads to higher blood sugar, fatigue, brain fog, and eventually long-term complications if unmanaged. Now here's the key point. Research shows insulin sensitivity can improve without weight loss through regular movement alone, not extreme exercise, not gym punishment. Consistent, repeatable movement. That matters. Because most people give up when the scales don't move, even though their internal health may already be improving. Let's talk joints. Carrying extra body weight increases compressive load on the knees, hips, and lower back. That's obvious. But what's less obvious is how inactivity worsens joint pain over time. Joints rely on movement to circulate nutrients through cartilage. Without movement, stiffness increases, pain thresholds drop, and mobility declines, creating a vicious cycle. Controlled movement helps lubricate joints, strengthen surrounding muscles, and improve confidence in movement, which is critical for long-term independence. Cardiovascular health is another area people misunderstand. Obesity is associated with higher blood pressure, higher resting heart rate, and increased cardiovascular risk. But again, movement changes this before weight loss. Studies consistently show that cardiorespiratory fitness reduces mortality risk independently of body weight. In simple terms, being active but overweight is healthier than being inactive and overweight. Then there's sleep. Excess weight is linked to sleep apnea, poor sleep quality, and chronic fatigue. Poor sleep worsens insulin resistance, increases appetite hormones, and reduces motivation. Movement improves sleep efficiency, which then improves energy, recovery, and consistency. Now let's talk about something rarely discussed: metabolic health. Many overweight people are metabolically unhealthy, but some are not. What separates them isn't genetics alone. It's behavior patterns. Regular movement improves mitochondrial function, the part of your cells responsible for energy production. Better energy production means better daily function, better mood, and better adherence to healthy behaviors. And this is where most programs fail. They treat obesity as a discipline problem, not a health condition influenced by biology, stress, environment, and long-term habits. Overweight people don't need more punishment. They need better systems that respect joint limits, systems that reduce overwhelm, systems that build health first, not just chase weight loss. That's why supported, structured movement works where extremes fail. Not because it's easy, but because it's sustainable. If you're dealing with type 2 diabetes, joint pain, high blood pressure, fatigue, or long-term weight struggles, progress doesn't come from pushing harder. It comes from doing the right things long enough, in a way your body can tolerate. That's the reality people deserve to hear.